and welcome to NHIS in a Week, where we give you the highlights and happenings of the authority. My name is Shanice Pao. Now to the headlines. President Mahama signs bill to uncap health insurance fund. NHIS boss applauds top performing districts for exceeding membership targets. And private health facilities resume services after NHIS payments assurance. To our first story, President John Dramani Mahama has signed into law the Earmarked Funds Capping and Realignment Amendment Bill 2025, unlocking more funding for National Health Insurance Scheme.
The new law uncaps the National Health Insurance, creating room for increased allocations to claims payment, procurement of medicines, and implementation of health initiatives like free primary health care and the Mahama Care. It also aims to close funding gaps created by declining donor support, including those from USAID.
This is the Earmarked Funds Capping and Realignment Bill. This is the bill that caps the GET Fund and National Health Insurance Levy and moves those resources into the Consolidated Fund. We promise that we'll take the capping off, we'll uncap them. And so this bill uncaps the GET Fund and the National Health Insurance Levy. So the Earmarked Funds Capping and Realignment Amendment Bill has been assented to. So it means GET Fund and NHIS will receive the full amount of their levies.
The NHIS is expected to leverage these additional funds to strengthen its operations and improve healthcare delivery across the country.
Moving on, the NHIS has recognized 10 district offices for surpassing their 2024 membership registration targets under the National Health Insurance Scheme. The acknowledgements came with personal calls from the Chief Executive himself.
Dr. Victor Asari-Bampo, accompanied by Director of Membership and Regional Operations, Mr. Otifrin Pong, reached out to high-performing district managers to commend their outstanding efforts.
It has come to my attention that you overachieved actually for Ghana East. You were supposed to, or you had a target of 165,550, and you actually got to 216,355. And the main purpose for this call is to actually congratulate you for the very good work that you and your team have done, to encourage you to continue to stay on top, and to know that we are watching some of these things that you do, because it really is a good thing that you've done. And so that's the main reason why we have called you today.
Thank you, Chief. I'm very grateful. Somewhere down the line, we were told that we have taken off the premium and the processing of 70 years and above, and that's of the net contributors. So we told ourselves, okay, so why don't we take advantage of these categories that have taken off the premium processing? We go to them, we convince them, we let them know the reason why they should join the NHIS. We shared ourselves among groups. We went to communities there. What we do is we explain to them that if you're 70 years and above, you need not to pay anything. You only have to join NHIS and you enjoy the benefits that comes with it.
Topping the list was the Ghana East District with a 130.7% achievement rate. Other top districts included Isio-Jaman, Kajebi, Ekwapem South, and Ho. The national target for 2024 stood at 20.8 million members, about 63.5% of Ghana's population. The gesture, hailed as a moral booster, reflects NHI's renewed focus on performance and accountability.
I think it's a very innovative idea coming from Chief, and listening to the feedback, you will see that the district managers are really humble. Just the phone call that was put through to them from Chief, and it's going to aid them to do more. And I think we'll continue other innovations to motivate these districts and then the regions who actually do well in terms of membership.
The Private Health Facilities Association of Ghana has withdrawn its suspension of services to NHIS cardholders following assurances from the National Health Insurance Authority.
The NHIA released a statement acknowledging the concerns of its service providers and reaffirmed its commitment to timely claims reimbursement. The authority confirmed that payment modalities have been concluded and disbursement of outstanding claims has begun. This development restores critical health care services for thousands of NHIS members across the country.
Efforts to expand National Health Insurance Scheme coverage to children between 6 and 14 years have received a boost following a key meeting between NHIA and the National Identification Authority.
At the meeting chaired by Mr. Vitus Kaleo, the acting NHIS director, the NHIA's head of technology and biometrics, Richard Akins, revealed the acquisition of some cards to clear a backlog that had hindered child registration. NHI's Director of Membership and Regional Operation, Mr. Otifrim Pong, and Director of Corporate Affairs, Mr. Oswald Esiamensa, emphasized the need to address technical and operational bottlenecks.
Let's give ourselves more time because we know things can go wrong.
Yes.
So we need 12, 15 days. Okay, so let's buffer in all these days to now and see when we can realistically start, print, package before school starts. They were ready to roll.
Mr. Joanno Dakwa, the project coordinator, outlined plans to resume the registration exercise.
Our proposal is that if we start, one, we should stop going to the schools, ask parents to bring their kids to the the offices, they will, and then the district can also arrange their normal outreaches that they do. The target is to register the 3 million.
Printing of the backlog Ghana cards is expected to begin on April 22, 2025, paving the way for thousands of children to gain access to health insurance services.
The National Health Insurance Authority is exploring new frontiers in healthcare financing following a high-level engagement with UnitAid and the Clinton Health Access Initiative.
The April 2nd visit aimed at strengthening the NHIA's operational model and improve access to medicines, diagnostics, and maternal health tools. UnitAid's Director of Strategy, Ms. Janet Ginard, expressed interest in working with the NHIA on sustainable domestic financing mechanisms.
From my perspective, I think this has been very, very helpful for us to understand how the NHIA is structured and approaches the work to reimburse the services. And I think that's tremendously useful context for us if we're thinking about a new project that might be able to support better access to a commodity, how that fits together. So from my perspective, it's been very helpful. I don't think this is a one-off conversation. I think it's a good baseline for continued discussion and collaboration.
The Deputy CEO of NHIA in charge of operations, Dr. Senanu Kwesi Jokoto, highlighted the relevance of government's uncapped levy to support long-term healthcare goals.
National Health Insurance Levy at a point in 2017-2018 was capped. So that in itself caused some constraints. But in this particular budget, recognizing the fact that there will be funding gaps because of the withdrawal of USAID, the levy was uncapped, meaning that whatever is collected from the levy should be available for the health service delivery. So all in all, it would improve the access that we are all looking for.
Directors from NHIA shared insights on claims processing, benefits packages, and system reforms that could help boost healthcare access.
The Global Alliance for Vaccines and Immunization, Gavi, is deepening collaboration with Ghana's National Health Insurance Authority as the country edges closer to self-financing its immunization programs. The engagement comes after Ghana prepares to transition from Gavi to support by the year 2030.
Gavi's senior country manager, Ms. Aisha Tusise, led a team to hold strategic discussions with NHI leadership. The meeting focused on sustainable vaccine financing as Ghana's increasing gross national income per capita urges it toward greater co-financing responsibilities. NHI's Deputy Chief Executive of Operations, Dr. Senanukwesi Jokoto, reiterated the importance of innovative financing models to ensure continuity in public health gains.
Obviously, the challenge has been the financing aspect. I think in 2023, as a country, we faced shortages, and we were informed it was because of the delays in honoring our part of the bargain as a country. So that is where the whole co-financing arrangement and how efficient that ought to be. And we are very confident that under the leadership of our CEO, Dr. Victor Asari Bampo, we would avert any possible shortages this year as well.
The Chief Executive of NHI, Dr. Victor Asari Bampo, assured Gavi of the authority's commitment to the immunization agenda, revealing government's pledge to allocate predictable funding for vaccines.
Our president is one of the strongest partners of Gavi, and he actually is a vaccine champion. We are hoping that this financing and late financing discussions will be a thing of the past, because I'm sure you've heard from our minister today, but a lot of the funding that we use for vaccines comes through the NHIF. Our Minister of Finance has also done a wonderful thing under the direction of our president, and that is that the funding that comes into the fund used to go through the consolidated fund. But now the Minister of Finance says our money is not going to touch the consolidated fund. So if that is the case, it means that we will have predictable and regular funding, which means that we can then, Gustav can issue your funds.
To our final story, the Old Students Association of Castle Hayford Hall, University of Cape Coast, has paid a courtesy call visit to the NHIA to strengthen institutional bonds and express gratitude.
Led by Mr. Oti Frimpong, chairman of the 2025 Annual General Meeting Committee, the delegation presented a plaque to the NHIA in appreciation of the authority's support during their 2024 annual event. Receiving the plaque, Acting Director of Corporate Affairs, Mr. Oswald Esiamensa, lauded the alumni for the recognition and encouraged all members to enroll and remain active in the National Health Insurance Scheme. The group also sought support for their upcoming AGM and pledged continued collaboration.
Give me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be Pedro board.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the power of you, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes, you can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
That's all that we have for you in this week's edition of NHIS in a Week. For more stories, do visit our website www.nhis.gov.gh or do visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.